The real truth behind the Black maternal mortality statistics. This episode will light your screen on fire. You've been warned.
We are going to talk about this new article that came out by US News that talked about the new statistics on maternal health. And given that this is Black Maternal Health Week, it's probably the most appropriate topic for us to talk about this evening. So let's talk about it. So one of the things that was really striking, so before we had sort of this estimated maternal mortality rate for 2018 that was believed to be somewhere about 730 for 2019, sorry, somewhere around 730 per year. Now we have the actual stats. And I was hoping that I would see a little bit better of a rate than we're seeing, considering the fact that we've started to make some changes in maternal health. But I'm really surprised. It's not that much better. The statistics from 2018 to 2019 actually increased in the overall maternity mortality rate, which means we're still the only developed country that has an increased rate. What do y'all think about that? That's kind of crazy.
I mean, I think it just goes with what we've always known the trend to be in the United States. If you look at what the causes are of these high rates of maternal mortality, it is high intervention rates. That hasn't really gone down. High C-section rates, our diet, and then when you bring race into it, well, that's a whole different conversation. Nothing has changed. I mean, if anything, I think maybe we've talked about this before, telling Black people that there's something inherently wrong with us, that message all the time, you start to internalize that. I was pregnant in 2018 when it first became a thing and everybody started talking about it. And all it made me feel was vulnerable. It didn't make me feel powerful. Right. And nobody really had any answers for me. And it was like, oh God, so just because I'm Black, I'm at high risk for all this,
Yeah.
So I think there's a lot of that, and then fear, and it makes sense. As far as I understand it, it makes sense.
But what about all these new programs and we're targeting and increasing birth workers? How come we're not seeing a lower rate given the fact that we started to do those things? What do you guys think about that?
Well, I think it takes a while for things to get put into place. Like, yeah, the preventative programs are being put into place, but sometimes it takes years to get the statistics, like longitudinal studies, to see what the outcomes are. So we're just putting the work into motion now. So the outcome is not going to happen overnight. We're only in 2021, like we're in the first quarter of 2021. So, and this is my thing, and just kind of piggyback on what Olivia was saying, like, this is my thing. It became a big trend 2018, 2017, I recall. But my thing is, this was happening prior to it becoming a medical health issue. It's always happened. They just became publicized, and the media took, I feel like sometimes, and I don't know, this might not be a popular opinion, but I feel like sometimes the media sensationalizes things. It makes it like a big issue. Not that this is a huge issue, but it's always been an issue in our communities. This has always been happening, and now it's just being highlighted, which is great. But besides putting it out there and just throwing statistics at us all the time, I feel like, what are we doing as individuals and as a community to really help each other? Because in the big picture, I don't see governmental efforts really being made to target these communities disproportionately that are being affected. Like, sometimes I feel like they use statistics against us just to kind of like really mentally mess with us. I understand that it's a serious problem.
But let's talk.
But you know what I mean? I feel like it's psychological warfare. Like, they're always throwing statistics about how we're this, how we're that. It's overwhelming.
It sounds a lot like what Olivia was saying. It's like, the statistics are not empowering. They're put out there, they're being broadcast, and they're being used, like you said, Eunice, to sensationalize an issue and make it now a trend. It's now the new thing. It's the thing that we all harp on, but what happens after the statistics, like what comes next. And like you said, okay, things are being put in place and you can't see it for a while. I literally was looking up at some notes from earlier, from looking at other maternal rate stuff, and not even looking at us just specifically, but maternal rates on a whole has increased in the United States. And whereas some of the other countries were trending down in the 2000s, we were trending up. So from 2000, we were going from in the like the teens in terms of percentages to now being somewhere like in the 20s, like 28 or whatever percent, when everybody else is coming out at like 9%. So the question becomes, what is it that we are not doing here in the United States? We know that it's going to disproportionately affect our community. And I think it's simple things like, we still have all the institutionalized things like the food desert. So you have all these good things like the EBT program. Yes, you have all these things that are providing, but what can you get to eat for EBT? Is that going to get you a healthy salad, or is that going to get you the fries that they sell in the little corner store or whatever? So it's not really helping.
And also like we all know what, I mean, it's like clear, studies have shown this in these Scandinavian countries or in these other countries that are developed nations as well. You know, a lot of people say, well, they have a healthier population. Yeah, they have a healthier population. They don't poison the food supply. Yeah, they have healthcare for everybody. Like, there are a lot of things, right, that make them a healthier population. They're better taken care of. Also, we know very clearly some steps that we could take. I mean, like, it's very clear the fact that we induce women that, I mean, so many things. We are a very interventionist country when it comes to healthcare and women's health, especially. Dr. T, you know this. And so it's like bringing that down. We haven't really brought that down. It's a, you know, socioeconomic status, talking about C-sections and who's getting them and why, and are we really supporting women and not having repeat C-sections? And, you know, like, when you hear stories of women who've had like 6 C-sections, it's like that. Why? Like, why was that even a thing? Why didn't anybody protect you and tell you, if you plan to have a big family, we should talk about you trying to have a vaginal birth? You know, also me putting a plug in for midwifery. I mean, we know the stats. We know that midwives really, really have great outcomes, right? We know that they have great outcomes in natural, healthy birth. Why haven't we worked more with midwives? Why haven't we pushed that further? You know, there's so many things that the United States, like, we umbrella and blanket statements, but the actual minutia and detail of how to actually make it work is actually there. We just don't do it. So much red tape and bureaucracy.
Yeah, I think it's so layered, and you guys brought up a couple of really, really good points. So let's talk about the midwifery services. Yes, in lower risk populations, midwives have great outcomes. The problem is we're getting more unhealthy. So then it goes to Dr. Trista's, the other Dr. T, Dr. Trista's point about about the fact that there are so many socioeconomic things that have not changed. And every single factor that you think of, Olivia, you mentioned like the C-section rate. Well, guess who tends to get cut more? You mentioned also the a couple of factors that really, if you look at all of those individual factors, the commonality is quite black and white. And that's part of the issue, is that racism is so embedded in all of these socioeconomic, from the food deserts that we talked about a few minutes ago, to what Black women are offered, to the fact that we're less likely to have access to really good healthcare or a holistic approach to healthcare. We're more likely to be cut. We're more likely to have all of these bad outcomes, that every single one of them have an underlying racial factor to it. And we haven't fixed that. We haven't even acknowledged that. That's something Olivia has mentioned before. Like the fact that, let's start with
Hello. I mean,
we haven't even acknowledged that.
Yeah, can we acknowledge how children were taken at birth in slavery, and how wet nursing was big and babies were being malnourished because they were too busy feeding white babies? Like, nobody I get really angry when we talk about stuff like this, because they tend to miss what even caused the issue, the root of the problem. And it all boils down to white supremacy and systemic racism in this country, period.
It is. And to your point, Eunice, this is why we are seeing 5.2 times higher rate of deaths amongst more educated Black women also. So it's not like the more educated you are, the more likely you'll have access to better healthcare. No, the outcomes are the same. Even if you have better access to healthcare, the outcomes are still the same. And to your point also, Eunice, the fact that there's something you mentioned I was going to say, but essentially, all in all, even with celebrities, we find that we're having the same outcome. We have celebrities so it's not education, it's not status. And basically, to your point, all of this underlying issue is white supremacy. It is being in a racist society, that every aspect of being a Black person leads to all of these outcomes. What do you guys think about being in a society where we're still also dealing with the police brutality. Do you think that that is a reflection or connected somehow to this particular issue?
Yeah. Like, when are we going to stop it? Like, who's going to put the stop to this? Who's going to put the stop? Who's going to be the word? Are we going to be, as a group, to be the person that say this needs to end and needs to stop? Like, you know, back then they did, you know, I had Black Panthers and everybody else to get together to stop some stuff. Like, when we going to have another group like that to stop some stuff?
You mean bringing like leadership, like a
like a unifying.
That's a great point, because the Black Panthers were the ones that started the free lunch program that the U.S. then implemented federally. So they demonized the Black Panthers, but what they were doing was pretty radical and pretty progressive in Oakland. And it's
Well, I think
that's a good point, Karen.
I think that's an excellent point, and I think it feeds into one of the discussions we had before, that all of these different elements are working completely separately. Like, people have different programs, and it's not to say that there isn't a need to really attack this issue from various perspectives, but there is no unifying effort. There is no centralized focus. And without that centralized focus, whether it's an organization that's similar to Black Panther in this particular day and age, it's just not happening.
I mean, I think the Black Lives Matter movement is really trying. There are a couple, and they every step of the way, even right now, there's a big campaign against them and Antifa, and also the president that we had. I mean, it really starts from the top, and you just so much distrust, and also you're like fighting the constant, never-ending barrage of information online. If you are talented at making anything seem credible, people think that's research. People think it's credible, and you just say all these things. So I would say that there are some leaders who are trying to step up, like Stacey Abrams. There are people out there. It's just, there's also so much from the other side and so much other that it's hard to figure out what's actually there and who's actually leading and how do we come together? I mean, you said, how is the killing of Black children and Black men and Black people affecting us? I mean, just you even having to ask that question. I mean, until Black bodies are respected, not just for the value that people think we're worth, we're still seen as commodities. We're still seen as, what are we worth? I was watching an award show yesterday, a Hispanic award show, a Latin American award show. And something that kills me is that now a big genre, and I've talked about this before, but it kills me, is called urban music. Okay. It's hip hop. It's essentially hip hop. And Black people in the 90s, they were talked all this mess about hip hop, these thugs, whatever. And now it's like become mainstream. You have Asian artists, Latino artists, everybody over here with sagging pants, showing their boxers, and they're all rapping and everything. Yet they're all white. Everybody wants to look white. They not one Black person on there. They don't show Black women. And I'm just like, we are just commodities to a lot of people. And that's why we say Black Lives Matter. It's because you can kill us and it's not going to happen. Nothing is going to matter. We're in pain and you think that we have an attitude. We stand up for ourselves and we're being aggressive. You don't actually care. That's the truth.
Right. And I think I'm glad you brought up sort of the Hispanic population. So let's talk about that, because one of the things that I thought was really interesting is that, so Hispanics also, the Latinx population also experience racism, right? But when you look at the maternal mortality rate, it's actually lower than even white America. So how do we explain that? How is that number what's the difference between the experience of Black America in 2020 versus Latinx America in 2020? We both experience racism, that's for sure, but the Latinx population, you guys have better outcomes. How is that happening?
I think it's a couple of things. I'm gonna let somebody else talk. I'm real passionate about this.
Well, go right.
Girl, speak your mind. Speak your mind.
Yeah, I mean, just because I want to know too, because we both live in a lot of our communities live in poverty. We have food deserts in our community. You go to a lot of the Latino communities, and we're plagued with the same illnesses. Diabetes is prevalent in Latino communities. Hypertension, obesity. Those are all factors that are very prevalent in Latino communities. Food deserts, a lot of us have very unhealthy eating habits in Latino communities. So I don't know why we're not having the same outcomes when a lot of women in pregnancy experience gestational diabetes in their pregnancies in Latino communities. So that's I would like to know that as a fellow Latina.
It's because they say that the reason that this is happening to Black Americans, because you also don't see it in African Americans. And by African Americans, I mean like the African immigrated population. It is because of systemic racism and slavery. They're saying that it is, you know, epigenetics. It is in our genes now, the stress and the constant having to survive and be in survival mode and all of this that we carry that then is in our genes, really. And so it's expressing in these ways. And so, yes, you have immigrant populations. Nobody's going to say that Asians don't experience racial hate, that Latinos don't. Nobody is saying that. But the thing is also is that Black Americans are the only people who don't know where they come from. So there's also research that shows it's not having ties to cultural identity. A lot of people come to this country looking for a better life. We didn't come in that capacity. So we don't have ties to our cultural identity. Most cultures who come here, other immigrants who come, they know where they come from. They have these cultures. They have this family unit. They don't have to overcome the feeling of you don't know your identity. You don't have the unity and the things that unite you in the way that other cultural classes do.
Okay, well, let me play devil's advocate, because Latinos are also an extension of colonization and slavery too. I mean, the slave ship went down south. West Indies, Caribbean folks were also enslaved too. So Belizeans, Hondurans, Panamanians, you go down the line and you see the African diaspora all through the Americas. But why is it that American Blacks, specifically African Americans in this country, disproportionately suffer from more of these social ills than these other communities of color, including Black immigrants?
Easy because of the way that institutionalized slavery and then racism happened in this country. No, really. So listen, so like in the Central American countries and Latin American countries, and even in the Caribbean,
they're primarily populated by whom and controlled by whom? That race and that group of people were in the United States.
Right, but also like their slavery was different, ended at different times, and also it did not become a part of the system of the government of the country where they were. So for example, places where, so it's hard to explain because there is classism, right? We know this, the darker you are, the less you're considered. We understand that, but in the United States, it really did become a systemic thing. So like they actually made laws to bring people down, to hold people down. In this country, it was actually written into law that a Black person was what, 1/3 of a person? I mean, this was law. And then you had to go fight to be seen as human under the law. And then when they created the 14th Amendment to say that we had rights, because of the Dred Scott decision and this justice that I can't remember his name, but they fought really hard so that Black people could be seen as citizens, meaning actually humans who were protected in this country as protection under the law. That then gave people birthright citizenship and was blanket for everybody. But then guess what? Then the states came out and the Supreme Court said, yeah, that's cool, but the states get to make their own laws. And that does not pertain to private citizens. And that's how for generations, white people could hang Black people, torture Black people, because they said that the 14th Amendment did not matter in private citizen affairs. So it is very different because in this country, it has been constant. It has been constant, and the laws are actually there. They're in writing and they're protected and they're pushed forward to keep us down.
Yeah, and that's what I mean by when you look at the Caribbean countries, when you look at the South American countries, when you look at Central American countries, they're still predominantly now the people who were once colonized are now running those countries. They are now in charge of those countries. They're now the dominant people in those countries. So there is a different level of empowerment, even though there is a similar experience or in a similar history of colonization in the United States. 3/5, yeah, that's what we were supposed to be, 3/5 of a person. And they still treat us like that. We're not, even when you hear a lot of these reports with these unfortunate incidents, violent incidents with police brutality, when you hear the logic on these newscast reports, there is still this underlying lack of understanding or even just humanity, just even looking at us in that perspective through that lens of humanity. There's always a justification or someone trying to justify the violence. Oh, he was in a gang. Oh, he was this. Oh, he should have been in school. Yeah, I heard y'all. I watched the news. And when you try to find reasons to try to decrease someone's humanity, it means that you fail to acknowledge that that person is human to begin with. And so you will always have that perspective. And when I hear leadership, especially in law enforcement leadership, say things like that, it absolutely explains why we're dealing with what we're dealing with, because that's leadership. And if leadership is like that, then the whole institution is going to continue. And I heard one comedian, I won't mention his name because I don't know if I can, but I will say something he said that I absolutely love. You guys probably know who it is because I absolutely love him. I have no shame in my love. But he said something that's really important, is like, oftentimes we're told to look for these good apples, that they're good apples, but we can't seem to find these good apples, because when the bad apples are doing what they always do, there is no good apple standing up. And the one good apple that stood up, this African-American woman, she got fired for trying to stop another cop from harming a young man. And so the fact that one incident tells us that even if there is that rarity of that good cop that is out there, then look what the system does. So to Olivia's point, the system is the issue, and the system continues to try to reinforce and to try to continue to monetize the underserved and the enslaved, and try, even though we have these quote unquote freedoms, there's still an effort to try to monetize on our suppression, on our on this white supremacy that exists in this country. And that is why we're still seeing the disparity in areas such as maternal mortality, because if it's in the institution that's supposed to guide the laws of the land, then the laws of the land are going to continue to suppress the people who are considered to be the underserved, the poor, the marginalized. And so it's going to be hard to make a difference. And that's the point I wanted to get to, is how can we make a difference in maternal mortality when the laws of the land, the protectors of the laws of the land, have not changed? And until that changes, I don't know that we can make this sub-layer change that we're trying to make. Because if the laws of the land and the protectors of the laws of the land are still suppressing the people, then moms who are, again, women as a whole, have been suppressed, white women included. That's why the numbers are the way they are. But even secondary to that, women of color, Black women at the very bottom, it's going to continue because there's profitability in that. And that's what we haven't, there's profitability in keeping people, oh, y'all made me study now, I'm getting so passionate. There's profitability in keeping people sick. Let's just talk about that part. Okay? Yeah. There's profitability in keeping people imprisoned. Let's just talk about that part. And until the profitability stops and the capitalism is restricted, they will continue to try to profit off of our bodies, profit off of our illnesses, profit off of our imprisonment. And that's basically what we're seeing.
I mean, perfect example was COVID. Look what COVID did to our communities. It showed who was affected disproportionately. COVID was the great revealer. It revealed the nasty truth about America. And people didn't want to recognize or realize what was happening right before their eyes.
Yes, yes. And to your point, Eunice, I think not only did the disease itself reveal, but the response to the disparity.
Yep.
Okay.
Yep.
And it's still being revealed.
Yeah.
It is still being revealed because there's still too much statistics and too much of the having to dive in. Like if you even think about the communities that are being vaccinated, like if you go by zip code. So right down here in Florida, there's a big problem because like Orange County, there's issue of reporting which communities are being vaccinated at higher rates than others. And you don't even, it doesn't even make sense you trying to imagine and guess. You already know how it's going down. And they're talking about using these numbers to be able to figure out where to put the rest of the FEMA pop-up sites. But it's the same thing. The certain communities are still not being served. The certain communities are still the last to get it. And it continues.
But let's talk about the media in that, right? So the media ran with this whole theory of, oh, it's vaccine hesitancy. It's because they're hesitant. But when you actually look at the numbers, into, yes, vaccine hesitancy does exist and exists throughout all of America. And it's more common right now in Republican white men. Hello, let's talk about it. They're not Black. So it tells us that this vaccine hesitancy, yes, it may be a factor, but it's not the primary factor. The primary factor, Dr. Trissa, was distribution of the vaccines and the neighborhoods where availability existed. So the fact that the news report kept running with this vaccine hesitancy theory and trying to propagate that, and then we were buying into that. Our community was eating that alive. Like, yes, it is vaccine hesitancy.
Self-destruct sequence activated.
I don't want to take that vaccine. No, boo-boo. They're not trying to give you the vaccine. That's the problem. You're not on the list.
But Dr. T, that goes back to my point, how they play psychological warfare. They throw these things at us so that we can bite, so we can like bite it. Like it's like they're trying, it's a gaslighting. It's psychological. Yes. It's gas. They gaslight us all the time.
Can I talk about that?
It's so pervasive.
You hit it on my sore thumb. Yes, let's talk about that, because and I think Olivia and I have talked about this. The fact that you are propagating this message, right, under the arms of, oh yes, we're trying to make a difference. No, you're not, because what you're doing is you are now traumatizing Black women, because you're telling, you know how many Black women tell me, I had this conversation yesterday with a patient of mine, how traumatized, and a friend of mine, how traumatized Black women are right now to be pregnant. They are traumatized throughout their entire pregnancy, because all everybody keeps thinking about is, I'm more likely to die as a result of pregnancy. So you have put out this message out there under the disguise of trying to help the issue. But when you put out a message like that Black women are more likely to die, and you don't give us and offer us an actual valid solution, then all you're doing is traumatizing Black women. Period.
And that's the goal. That's what they want to do. I feel like it's a form of population control. They want to scare women, Black women, to not have children and not reproduce, because that's a way to stop us from expanding and growing, because they know by 2050 this is going to be a country full of colored people, and they don't want that. So they're going to use all the tactics they can, psychological warfare, to make us scared so that we don't reproduce. Because back in the day, we were reproducing, Black people were reproducing at much higher rates. They know that they're not going to be able to keep I was just having this conversation with another, today with another Black therapist today, a mother of two.
Amen. Amen. You just got me over here like, amen. Girl, if I could shout, I would. Yes.
No, it's Jesus. The truth. I'm really starting to realize that all these statistics is nothing but psychological warfare.
Yes.
They're using this. It's tactical.
I have been saying this, and I was telling Dr. T, I was like, listen, since when I do home birth, there are so many Black women who are like, it does not matter if I'm dying at home, I will not go to the hospital. They're going to try to kill me there. And I'm like, this is crazy. This is absolutely crazy.
It's heartbreaking.
When it is like when the hospital is where you should be, but you're so afraid, and rightfully so. And I understand the genesis of it. But like you said, you threw us out there and you didn't give us a life raft. You didn't give us anything to come back to. How do I then rebuild the trust between me and you? Right? Like now Black women are all alone all again.
The plan. And now you're having this shift where Black women who have high risk issues, because we're already at the end point, right? It's not that, we're at the beginning where we can reverse these issues. We're already diabetic. We're already hypertensive. We already have high cholesterol. We already have heart disease. And now we're running towards non-clinical personnel for a safety net, right? But that's what they want, right? Because they know if you're running towards non-clinicals who don't have the skill, because you're running away from the clinicals, then you're more likely also to have bad outcomes, because they're not clinicians who can deal with the higher risk population. So yes, in the other generations to come, we can make a difference to try to break these cycles of these endpoints of diabetes and all the chronic diseases. But right now we have a population that's unhealthy. And right now we need to deal with that. And somehow we need to all come together to work on this, because now we're chasing women in that direction. Then they're running in that direction. Then they're running back over there. They don't know who to trust. And everybody's all over the place. And that's not the way it works. The whole point is for us to work together. I completely co-sign what you guys said. I think this is completely psychological. It is messing with Black women, and it is working. And that's the problem. Because you know how many messages I get all the time about from my friends to my patients who are absolutely terrified.
Heartbreaking, girl. Heartbreaking.
Yeah. I have these conversations with my best friends who are Black, and they're older, they're over 35. And now that they're in a position financially, they're more secure. Now they want to have kids, recently got married, and now they're scared to get pregnant because they're afraid. They're older. They don't know what's going to happen. They're afraid that they might end up developing, you know, some kind of complication because they're 37, 38 and they're Black. And it's sad. I'll even tell you, I don't even want any more kids. I don't. I'm 36 and I don't want more kids because I'm scared. I had issues at 30. So I don't want kids now.
Because the mortality rate is significantly higher for 40-year-olds and older. It's 75.5 per 100,000 live births. Whereas if you're 25 years or less than 25 years, it's 12 in 100,000 births. So that's valid.
I feel like they lied to us. I feel like I told you, I've been telling you this now that I'm older. I feel like they lied to us and we took the okie doke. We should have had babies younger. They lied to us. They were like, you don't want to be losers. You want to go to school. You want to have a career. You want to do this with your life and then have your kids later. Nah, we should have stuck to our old indigenous traditional ways.
I did it. I did it.
The conversation I have with my friends who are all in their 30s, early 40s.
Yes.
When you got your kids, what will you tell? What will you tell those kids? And honest to goodness, if my son, who is now 4, comes to me when he's like 16 and says, Mommy, I want to go to college, but I want to get, boy, you better go have some children.
Yes, I'm serious. I
told my husband 30 was the cutoff date.
Yeah, when
30 was the cutoff. After 30, I wasn't having no more kids, and that's what I did. I had all 3 before 30. Sorry.
I say, if my daughter comes to me when she's like 19 or 20 and says, you know, Mama, you know, I'm pregnant or I want to have babies young, I'm going to tell her, I am going to support you. Like, I will support you. I know you have goals. You don't have to choose. And you don't have to believe that, like, you turn 18 and you have to leave the house and be in there. This is all lies. The people we come from stay together. You hear me?
Yes.
Yes.
It's true. It's true. And I will say before we wrap up, the other thing that we have to do is change the attitudes about surgery. I actually had this conversation just yesterday with a patient of mine. The fact that we're so quick to have surgery has the whole public, like this C-section on demand, elective C-section. Can we stop that? That's just some madness right now. It really is.
Yeah, again, fell for the okie doke. They lied to us. Don't do it.
C-section is surgery. Surgery is serious.
Huge.
And it doesn't protect your pelvic floor. No, it doesn't.
Come on, Dr. Trista, say that one more time for the people in the back before we go.
It does not protect your pelvic floor. Pregnancy will affect your pelvic floor.
Say that one more time.
Pregnancy will affect your pelvic floor. Your mode and method of delivery is not the end all be all.
That part.
That is, I thought that for the longest. I'm not gonna lie. I thought I thought C-section would be better for my vagina. I admit it. I was wrong.
Once you did, it's a wrap. Period. But you guys have been awesome. Boy, we lit this topic on fire. Come on, midwives, tell them where they can find you.
On Instagram at This American Midwife.
And come on, Dr. Trista, where can they find you?
On Instagram at tristajob.dpt. It's been a while, y'all.
Chastity gonna be impressed. Come on. What a touch. Where can they find you?
Like you said, what that touch? What a touch on Instagram.
Come on, lighting this topic on fire, Eunice. Where can they find you?
At Eunice, EUNICDA therapist at IG.
And this is Dr. T, the hand behind the handle of Healthy Bump Club. You can find this full video where on YouTube. You can find clips and all of our updates on Instagram under the hashtag, under the handle Healthy Bump Club. Hope to see you there. If you like this video, make sure you check out all the others. Make sure you click like, make sure you share, and make sure you comment below. We love y'all. We see y'all next episode. Bye.
Bye.
We love that you are a part of our community, and we want you to continue to be a part of our community. So go ahead and do what? Like the videos, hit notification, and subscribe. We appreciate you guys.